seeking blessing, guidance, and wisdom from God Almighty. Thank you, rise to the prayer.
Ensuring the highest standards of patient care. I welcome you to deliver the welcome address.
Sunshine is a welcome thing as it begins a lot of brightness. And sometimes the hurdles are not real hurdles at all. They are welcome challenges, just that we have to step over and go ahead with what we have done. Today, it is our honor to have our Pro-Chancellor, Professor Dr. M.S. Shantaram Shetty for all of us, to be here with us for this program, inauguration program. We have always been supported by Sir in all our endeavors, and this being one of the first programs of the hospital, we are so happy that Sir could spare his time in spite of his busy personal and academic programs that he has to attend to. Thank you, Sir, for being with us. You have been always a support and a guidance to all of us. Having said that, I would also like to place welcome note for our Chancellor, Pro-Chancellor, Vishal Hegde. They are also welcome. Sirs might drop in any time to have a look and share a moment with us. It's my honor to have here with us Colonel S.D. Jyoti, who is the Deputy Principal and Matron at Command Hospital, Air Force, Bangalore. She has graciously agreed to be the chief guest on this event. She did a general nursing and midwifery, IMHS Sanjeevani, Cochin, Kerala, and from the AFMS board in 1990, followed by diploma in psychiatry nursing, NIMANS, Bangalore in 1995. She completed her PC, BSc nursing in AFMC Pune under the Maharashtra University of Health Sciences in 2005. She completed her MBA in 2012 and MA Psychology in 2023 from IGNOU. Since 1990, she is serving in the military nursing services in various capacities. She has been a trainer for psychiatry nursing classes for JNM BSc nursing students, has conducted psychological counseling courses for combatants in the infection control nurse at Command Hospital, Air Force, Bangalore. Presently, she is working as a deputy principal matron at the Command Hospital, Air Force in Bangalore. She has presented a paper in ISPG Gold 2 during the Patient Safety Week in 2021. She is here to present a paper on International Safety Goals IPSD Gold 6 in the scientific session and contribute a valuable insights and foster discussions on the global safety initiatives. Thank you, Madam, for accepting our invitation to today's session. Who are here, the heads of the institutions and the faculties of different institutions under the NITE University. I recognize the presence of Dr. Anirban Chakravarti, Dr. Sudhindra from Chema, Anirban Chakravarti from Luxor, and many of faculties who are part of our workshops and the scientific sessions. We welcome all the delegates and the volunteers and the faculty members who have been part and parcel of this conference of 2 days, and I hope you have a good stay here, and we are privileged to host this event, and we welcome you with open arms, open hearts, and more importantly open minds to listen and to interact in the next 2 days about IPSD goals 1 to 6. Thank you.
To extend a warm welcome to our esteemed chief guest, Colonel Jyoti. She brings with her a wealth of experience and dedication in the field of healthcare. In her role as Deputy Principal Mathan, she is instrumental in setting very high standards of patient safety and nursing education. We kindly welcome you, ma'am, to talk a few words.
A very good morning to all of you. First and foremost, mango is very pleasant today, not warm. So that's a welcome thing for the program also. The Chancellor of Hegde University, Professor Dr. Shantaram Shetty, Sumalata ma'am, Medical Superintendent, Colonel Elizabeth ma'am, ladies and gentlemen, esteemed healthcare professionals and distinguished guests, greetings from Command Hospital as well as from our Armed Forces Defence Services. It's honor, a privilege to stand here, and I'm very, very thankful for me being invited here. So, it's something that we must understand. Patient safety is not just a checklist. It's not something that we're going to take. Our program is done, but it is something that we need to inculcate in our daily practice. I was just traveling yesterday when I realized that when there's a red signal, nobody needs to tell us there's a red signal. We know that there's a red signal and we need to stop. So similarly, this should be inculcated in such a way that when you look at a patient, you know what is to be done for this patient. So that is a kind of training, that is a kind of outlook that we are looking at. So in the healthcare industry where lives are entrusted to our hands, nobody comes and questions us, what are you doing, why you are doing it, because they trust us, because we are trained. So that is where we matter. We as healthcare professionals, doctors, nurses, paramedics, each one of us, the patients have given themselves up to us. So that's how our care matters so much more. So in the fast evolving landscape of medicine, collaboration and continuous learning are paramount. This confidence, I am assured, will serve as a platform for us to exchange insights, learn from each other's. The nursing team will tell us how the paramedic team will tell us. So each of us will contribute and collaborate and learn how best we can manage patient safety. So in our pursuit for elevating patient safety standards, it's crucial to align our efforts with globally recognized benchmarks. So what are the globally recognized benchmarks? Any students? Basically our WHO standards, we're talking about the International Patient Safety Goals, and also we talk about the JCI standards. So they serve as a framework for us to continue working towards it. So IPSD framework, as in the next 2 days we will see, has 6 important goals. So we'll be deliberating upon it. I'm assured that we have 6 different skill stations wherein we can see how we can go about it. So JCI with its rigorous accreditation standards provides a roadmap for excellence in healthcare delivery. Adherence to JCI standards not only instills confidence in our patients. So when we claim, when we advertise that our hospital is according to the JCI standards, our hospital is NABH standard, so what does it mean? The patients are assured that, okay, I'll get the best of care here. It is also that our hospital operates at the pinnacle of global healthcare quality. So in the realm of patient safety, the partnership, like ma'am was mentioning to me the other day, it is so very important. During the COVID pandemic, everyone thought that hospitals are going to be closed and routine care is not going to happen. How many patients died sitting at home? Actually, not many died sitting at home. Because they did not come, they did not get operated, they were not exposed to the, the patient safety concerns in the hospital. So it is not necessary that when the patient come to us, they become completely alright. What is important is when they are coming to us for surgery, when they are coming to us for care, it is equally important how safely we are looking after them. When we are carrying out a procedure on them, we also need to equally look after them in that way. Okay? So these NGOs and PSUs, the public sector undertakings, also play a very, very important role. The NGOs can drive with passion to do that. We all know when Amitabh Bachchan washed his hands, he showed us that this is the way it is so important to, hand washing. All of us did hand washing during COVID times, right? So why was it? Because some people were the driving force. So similarly, we expect even during the patient safety standards, we expect that the NGOs also take important care. So this is also a very important aspect of our care. So I'm told here, Madam was just mentioning to me, like I mentioned earlier also, that we have nurses, we have all paramedical staff. So I expect in these 2 days that we will be enlightened about how to go about this. Okay? So as physiotherapy also, madam, you were saying? So physiotherapy and nurses, all of us are very, very important. That we are the driving force behind how patients, like the nursing, the goal of nursing is sending them back to the society where they were. So in order to achieve that goal, all of us need to strive. So in these 2 days, we immerse ourselves into discussion and workshop, and let us understand that each and every action of ours will impact the patient once they go back. Once again, not keeping much in between you and the workshops. I'm extremely happy to be here, and I hope when I speak for the patient goal 6, IPSD 6, it would be, I would have gained all the 5 before I speak for the 6. So thank you so much for having me here, and I look forward to very, very fruitful discussions. And okay, thank you.
Professor Dr. Shantaram Shetty, Pro-Chancellor, Nitya University, to felicitate our distinguished Chief Guest, Colonel Jyoti. Now, for the presidential address, I welcome our esteemed Pro-Chancellor of Nitya University, Professor Dr. Shantaram Shetty.
Good morning to each one of you. Esteemed Chief Guest of the Day, Colonel Jyoti, who is commanding one of the important institutions of our country, Command Hospital at Bangalore, and was kind enough to be here with us this beautiful morning. Our own medical superintendent, who is responsible to arrange this international safety goals under the Global Patient Safety Action Plan, and very elegant Dr. Suma. Our nursing superintendent, who has made a lot of changes and responsible for our hospital to be what it is today. And she was equally responsible for arranging this workshop for all of you. I'm indeed very happy to see more than 300 delegates from different parts of our district and the adjoining districts participating in it. Colonel Parvati, who is with us, who has accompanied Colonel Jyoti, our members of the staff, directors, dear delegates. I consider it indeed a privilege to be here this morning and participate in this function of the International Patient Safety Goals. As a surgeon for the last 50 years, I have gone through the ups and downs of surgery. I have gone through the triumphs and the pain of surgery. I have gone through the ecstasy and at the same time how critical it could be if you had done a mistake. So all through flashes through my mind that how important it is to be very careful and a safety care in the patient care. You may be surprised to know, delegates, that as many as nearly about 6 million patients, one way or the other, are affected by not being properly cared all together. Out of which, mind you, 2.6 million. There, I got it through the Google, but your booklet, there is a little change. Yeah, 2.6 million patients die because of you and me because of the healthcare workers. Mind you, the COVID, which alarmed the whole world, partly destroyed the whole world, killed only 5 million patients all over the world in 2 years, 3 years. This is 1 year statistics, 2.6 million is an alarming number. So that's why world over they thought something has to be done. The World Health Assembly in 2019 passed a resolution that every hospital, every country who deal with healthcare will have to pass through this international patient safety goals. And it was again 2021, WHO took over the whole run and passed a resolution that it is mandatory that it is important international patient safety goals are undertaken. Going through the goals, I learned the goals, which are, though I am fairly senior in the clinical faculty, this has been very well documented. What is important is identifying the patient. Identifying the patient. I have seen in my 50 years, wrong identity, wrong limbs have been amputated. And you have read in the newspapers, wrong eye has been operated. The other eye was blind and you are blinded the other eye as well. And the wrong side of the brain has been operated, as all of you know, it flashed through the newspapers many times. So it is an agony. If we go through the London Museum, there is a specimen of a limb by Arbuthnot Lane, Sir Arbuthnot Lane, who kept that specimen. This was the limb I wrongly amputated. He had the guts and the courage. It was nearly about 250 years ago. So he had the courage to tell the people, be careful that you should not err, at least in what side you are operating, what part you are operating, whom you are operating. Wrong patients have been operated. So it is very important to identify the patient at large. Number two, they specify communication. I feel communication in every part of life is paramount. If you do not communicate well with your patients, you are a failure. However good you may be as a surgeon, a physician, as a nursing staff or a paramedical worker, if you do not communicate, what is important is just a smile on your face. Smile on your face to tell the patient, I am here with you. That is communication. Tell the patient what is to be done and what is not to be done, what surgery is undertaken, which will fail. And if not the chief surgeon, at least his assistant or the nursing staff or the paramedical will have to do it. We are a team. I always, when I mention about team, all of you know we lost the World Cup finals in Ahmedabad. And the blame was that the team did not really manage well. No, they managed well. They won all the 10 matches. But finally they lost because a better team won the game. So it is the team. If the wicketkeeper doesn't stump the ball, stump the wickets, we lose the game. If the captain doesn't play his role as a captain, we lose the game. If the slip fielder doesn't catch this ball, we lose the game. So it is a teamwork, and you are all a part of the team to see that ultimate patient care is given. Number three is high alert medication. High alert medication. It is so important. There are physicians, our head of the department of medicine is here. And when I see some of the prescriptions, not of the physicians, every one of us, there are 10 drugs, 12 drugs, 14 drugs. So there is a famous saying, if all the medications, all the tablets and medications are put into the sea, it is so much better for the mankind and so much ill for the fishes in the sea. It is true. It is true by the fact the medication is so important. What is the dosage? If it is more dosage or less dosage, it should be given or not. What is the interaction? We do not many times say, we depend on a particular faculty and decide. So it has to be a teamwork game, that the correct medication, all of you are a part of it. you preserve, and if there is something wrong, I am so grateful many times when my nurse is there, when my ward nurse comes and tells her there is something wrong with this. There is something wrong with this, either the dosage is too much or the dosage is too less, or should I give it 2 times or 3 times a day. It is so important that you have to follow it. The other bugbear, I do not see many surgeons here, but at the same time our anesthesia professor is here. We are all responsible for the infection. Infection is such an important fact. I see infection almost every day in my life. The agony of the patient. A simple surgery which he should have gone home in 2 days' time because of the infection, because of the negligence on part of the whole team. Either the autoclaving is not done properly, or the draping is not done properly, or the washing is not done properly, or the surgeon's fault that he hasn't mandated properly. So that is important, that you are a team. The other aspect with the goals which I mentioned is surgical technique. Surgical technique, we surgeons will have to do. Many times we do not plan, but many times we are so busy that we just, many times when I enter the theatre, my assistant would have draped everything and just many times even the incision is done and finally we put our prosthesis. No. It has to be a plan. If you do not plan, you plan to fail. If you do not plan, you plan to fail. So it is mandatory the day before in any department, whether it is surgery or medicine or any department, they will have to plan what is important for that particular patient. That has to be done. So that is the goal of the international safety, which has been very well documented. Finally, the prevention of falls. That has been added on this goal. It is quite important. Prevention of falls. Many of you may not know that almost the present life expectancy, which was just 59 just 10 years ago, has gone up to 69. In our own country, in Sweden or in Japan, it is almost 79 to 80 years ago. So our elderly people fall so often without being guided how they fall, why they fall, and many times we do not see even the best of the hospitals. The facilities are not given an elderly person or a handicapped person to go into the stairs or get into the particular hospital. Many of these devices like hip pads for the elderly patient, or the spectacles which are to be worn has to be worn properly, or how he has to live has to be taught by all of us, including the nursing staff. So these goals, I am very happy. I learned a lot and have been very well specified. All of you, the doctors, the surgeons, the physicians, the paramedical workers, the nursing staff, as I told you, is a part of this game. It is a God-given gift to you as a health worker. It is a God-given gift to you as a health worker, which no other profession can claim, that I will relieve pain. I will make the patient happy. I will make the patient go back to the society as a normal individual, as our chief just said. That is important. So my plea is, be a part of this case. I really congratulate our medical superintendent, Dr. Sublata, and Colonel Elizabeth for getting all of you together. If one of you can prevent a happening of not safety, of a complication, the day is done. And that is the motto of this whole workshop today. I wish you all well. May God bless you. And go back to your individual institutions. Whatever you have learned today, copy it and practice it every day in your life, so that our patients will be happy that this institution and this particular lady or this particular gentleman has made my life worthwhile. Thank you very much.
She has 23 years experience in Army, Air Force and Navy and 11 years in corporate sectors. Her insights have been instrumental in making this event a success.
Ladies and gentlemen, my friends, juniors, seniors, a very warm welcome to all of you. As Ms. Jyoti was correctly mentioning, The temperature was not so very pleasant until the day before, I suppose. They have brought in the temperature, cool temperature of Bangalore here to us. I suppose it's really very, very comfortable. We must thank Almighty for that kind of shower of blessings from Him. Anyway, at the outset, it gives me immense pleasure to deliver the word of thanks for this event, and thanks all the dignitaries to be present here. We accord our sincere gratitude to the Chancellor and the Pro-Chancellor Admin for their constant support and encouragement in all our endeavours. Very respected Pro-Chancellor, he is always loved by everybody, especially my medical superintendent ma'am. Without him, she keeps saying, sir, 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 he has to come, and we have pulled him really, sir, has to be around us. Thank you so much for being with us for peace. We are really humble and you have consented to be with us. We are blessed, sir. Our gratitude to the Dean of the Medical College, Professor Dr. P.S. Prakash, his valuable advice and has helped us to organize this event successfully. Thank you, sir. This is a memorable event for all of us here. On this very occasion of Silver Jubilee celebration of this medical college, we, the Faculty of Justice, K.S. Hegde Charitable Hospital, have organized this event. These 2 days scientific sessions followed by the corresponding workshops on IPSG, which is the need of the hour. It is the very first deliberation of this kind that has been undertaken by the hospital under the staunch leadership of Dr. Sumalata Shetty, our medical superintendent, as the organizing chairperson. Thank you, ma'am, for leading us through this planning and for successful execution of the same. My heartfelt gratitude to my friend and the chief guest of the inaugural program, Colonel Jyoti, the Deputy Principal Matron of the Command Hospital Airport. I really have no words to express. Thank you for sharing your thoughts on the global scenario of patient safety. We are looking forward to hear you again tomorrow as you speak on the 6th goal of International Patient Safety Goals. We wish you a pleasant stay at Mangalore, though it's your own place. Thanks to all the resource personnel, panelists, and all our healthcare members in the services to the humanity for their exceptional efforts and your time and dedication that they have put into the success of this work. The logistic team for the outstanding efforts in ensuring smooth execution of these 2 days program with the delivery great day. Let's go with the takeaway from us. Let's contribute, take a lot of things from this exercise. Wish you all very good luck.